there's the proposed hypothesis about IBD really stems from that there's a genetic susceptibility, meaning we believe that you can't get IBD or these immune diseases without a genetic underlying susceptibility. Thought that in these genetically susceptible hosts, it's somewhat of an abnormal immune reaction to what we believe is our own gut flora. So as in other immune diseases, such as diabetes, it's an immune reaction to the pancreas, against the pancreas, the thyroid for low or high thyroid. So there is an organ that is the target. But what's interesting here is that we're saying that it's against specifically the bacteria that occupies our microbiome, where there's trillions of bacteria. And we believe that there's an environmental trigger that somehow changes the way that our genes view our host bacteria. There's a lot of theories about the role of the microbiome, which has really become very important in the research space. There's a lot of initiatives that are targeting the microbiome with the idea that the past sort of decade was all about the human genome and finding these genetic susceptibility loci. And there's over 250 genes that have now been shown to be associated with IBD, which makes it more complicated, because if you have trillions of bacteria and hundreds of genes and we don't know what the environmental factor is, it really lends itself to be complicated to, I think, focus on cure. And that's why a cure has been difficult to sort of land on. But I think an understanding of all of these factors will help us sort of choose better treatment options once we start individualizing therapy based on someone's underlying gene and microbiome patterns. And or maybe if we understand the environmental trigger, we can even think about prevention of disease.